Hi, my name is Virgil, I'm a massage therapist and I want to present you today how I do a deep tissue massage, or sometimes it's called a sportive massage. A deep tissue massage don't have to be the equivalent with pressure and a lot of pressure. What I like to be is to be a massage that it feels profound, deep into the layers without hurting them. So I like to prepare the body with long strokes. Actually, it's a myofascial release technique. Working with the superficial layers at the beginning and doing like a warm-up for the session. What I want the client to feel is not a big sharp pressure, just a profound sensation that it's releasing the deep muscles. So I like to work with an open fist, just slow. Just working slowly, you are penetrating in a deep fascial layers and you are unwinding them. So if there is any scar tissue from an over workout, for example, all those fibers will rearrange in a proper manner. Always check the pressure with the client, especially in the lower back. You can't apply the same pressure like in the upper back. Here we have an area that is not gardening so well, like the upper back with the rib cage, and we have the kidneys that we don't want to harm them. With bigger clients or clients who need more pressure, you can always use the forearm and the elbow. Always drag this tissue from the front, from the anterior to posterior, and go slowly, going deep, passing the trapezius muscle, the rhomboids, going to those paravertebral muscles. Actually, what I'm doing now is just the pressure of my body, and I'm not going vertically, I'm not pressing down the ribcage, just I'm going like, oblique slide. And if your client will require more pressure, you can always change the angle of the forearm and go with your elbow slowly. And always try to don't go on the spine, and you can always check the track of your elbow with the other hand just by putting here the finger and keeping it the track. So if I want more pressure, I'm just taking my forearm in another position, so I'm with my elbow going slowly and dragging all these fascia layers from upper to lower back. You can always change and work from lower back to the upper back. It's giving another sensation, and always try to do the same thing, just going slowly, sliding, taking always care, don't be on the spine, and always check the pressure with your client. For the upper trapezius, what I always like to do, I like to put the muscle in a relaxed position. So here it's a relaxed position. It's opposite, like if I work here, this is a muscle that it's elongated, and it always be very painful if I'm working with it. So going with the arm here, I'm just putting the trapezius in a relaxed state. You can always, if you have a chair or something, you can put the arm in the front, but here it's a very good position. And the upper trapezius, I like to squeeze it, and very often you can find trigger points right here at the end of the muscle. You can find some good trigger points. And if you have a client that has a lot of tension and just one hand is not enough, you can always reinforce it, okay, with the other hand, and you can reinforce, and now you have two hands. I can help you. And what I very often like to do to relax this part of the body is to work from the cervical area, the occipital area, where this muscle has the insertion, and just drag the fibers laterally. So this is the direction of the fiber, and sometimes just to take them from the cervicals and laterally, but also downward, taking them in the back. I'm working also in the same time with the levator scapula, another muscle that is involving headaches, and sometimes it's in charge for a crick in the neck. You can always be specific, going with your finger, reinforce it, and you can find some trigger points. I always check with the client. If you find one, just stay there for 20-30 seconds to 1 minute till the client will tell you there is no tension anymore. Thank you for watching.